some real life instances, there's actually some published data to support the fact that the way the XX and some of our vitamins have been put together and products like the vitamin D that we can get from excess, what are the bodily functions that you can actually improve and what are the diseases you can prevent by taking these nutrients in the right amounts, in the right combinations. I'm just going to show you a little bit about, what are the nutritional challenges that we talk about. There is a WHO report on diet and disease that actually tells you that poor diet and lack of exercise are leading causes of some of the non-communicable diseases like cardiovascular disease, type 2 diabetes, certain cancers that account for nearly 60% or 56.6 million deaths a year that are actually preventable. And what are the things that contribute to this? Stress, smoking, pollution, alcohol, and fast food. And before saying this, I want to make a disclaimer. Some of the slides that I have here, a few of them have been borrowed from a health seminar that we did that TD and Suparna put together in the DC, Maryland area, and we, all the physicians and scientists in the group got together and made little presentation on different organs. But I'm going to focus here more on genetic health. But I borrowed a few slides to tell you about some of the factors that affect our health. So on the top of the list, as you can see, the genes are there. Now it's not so unfortunate that we cannot change what we were born with. You can actually modify the effect of some of these genes, and that is what Nutrilite has done together with the Interleukin Genetics, the company that has developed these diagnostic tests. The other thing is diet, and that includes both micro and macronutrients, exercise, environment. The water that you drink is extremely important. Why? Because our body is made by 75% of water. And then, of course, stress is a big part of all these diseases. So if you're making enough money, you're leading a stress-free life, you don't have to have the worries, that cause all these problems again. So that's another good reason to build this business. Okay? Now look at all the vitamins. Inadequate intake of several vitamins are linked to chronic diseases like coronary artery disease. That is, diseases of the blood vessels that actually serve your very heart muscle. How many of you know that if some of you have cholesterol problems and you're taking drugs like Lipitor and all, those drugs actually damage the very heart that you are trying to protect. And if you look at the small print, actually the other day I was looking at some small print just to see what are the side effects. There are more side effects than the benefits of the drug. And if you don't know that if you're taking cholesterol medication, you need to take coenzyme Q10. There's a small disclaimer that says, with all due respect to any physicians in the room, you can sue the doctor if he doesn't prescribe CoQ10 when you're taking cholesterol medicine, because it actually depletes your heart muscle, including other muscles in your body. So, as you think you're lowering your cholesterol, you're actually damaging all the other functions of your body, liver, kidney, muscle, heart, everything. Then cancer and osteoporosis, and this was actually published in the Journal of the American Medical Association in June of 2002. Now, this is the new food pyramid, and in one of our team meetings, Naveen actually showed this food pyramid, and if you look at the top of the list, fats, oil, sweet, use sparingly. And how many of that follow that? I'm actually one bad example for this one. But look, you also have to take calcium, vitamin B, B12, vitamin D supplements in moderation. So just because it's available, don't fill yourselves up to that. You need to know how much does your body need, and that can be done with a supplementation regime. Then, of course, what is the most critical ingredient in your diet? Water. How many of you know that if you drink cabbage water for the rest of your life, you can shed a lot of pounds, but you want to be alive, why you do that? So I don't say drink only water, but you have to drink at least 8 to 10 glasses of water a day, because your body needs water. You can even prevent aging if you hydrate yourself properly. And then, of course, all the vegetables and all that. So, and this is the average American. Isn't it so true? Fortunately for us, I hope it's not true. But if you ask the average American what is their favorite food, it is the hamburger. And you will very often see a family of 6 sitting around the table eating hamburgers and a huge Diet Coke. Really, that doesn't make any sense at all. All the calories in the hamburger, not just the diet. So, I'm just going to quickly tell you what the Center of Optimal Health is doing, and for some of you who are going to be, able to take advantage of what the Center for Optimal Health is offering to do a full genetic profiling of, when you go to a field, then it's going to be a great opportunity. And these are some of the reasons why we want to stick with Nutrilite. It's not world's leading brand of vitamins, minerals, and dietary supplements. It's the only global brand that does it right from seed to finish. They don't have ingredients that are pulled from any and everywhere. Because the vitamin industry is really the most spurious industry that you can get. Very recently, there was another, I think in Fox News or CNN, all the omega-3s that were in CVS, GNC, Rite Aid, Pharmanex, all the leading pharmacies in the country were full because omega-3 was contaminated with what they call as PBCs. And that's a very common ingredient in fish oil. So just because it's cheaper, don't go there and buy it. If you have all your records right, you will not buy anything other than omega-3s from our own business. And they're some of the best omega-3s, and they were the only ones that were never withdrawn. And not that Nutrilite doesn't put it up for testing. They're also frequently tested, and we always come up to the top. Okay, so make sure that you're taking the right omega-3s without all the contamination from fish. So I won't run through all this, but today I'm going to talk about basically on how to focus on your genetic health. And you know what the magic number 23 is? The number of chromosomes we have. And some of you who remember from our joint phase, everybody was very excited when I said, women are that much more special because we have an extra X chromosome. The Y chromosome actually has hardly any genes in it that are important. But that it actually has one important gene, and that's what causes the hair in the ear of men. But I'm kidding, there are a couple of other. That's what makes men what they are, so we are very thankful for putting that in. So the only thing I want to tell you that your health is actually very predictable. And if you do a genetic test, you can actually determine what is in your genes and how can you help modify what is in your genes. And if you ask, this is a famous quote. I used to always show that even when I was in the pharmaceutical industry, because what the pharmaceutical industry is trying to do is to find that one magic pill that will treat everything. And that's never going to happen because, they want to make their billions of dollars by that one